Here are 3 reasons why your gums recede that I see all the time as a dentist. And reason number 1 is stress. Not emotional stress, but jaw stress. And this is often the most underdiagnosed cause of gum recession I usually see. And I've seen patients with perfect oral hygiene, brushing, flossing, having regular cleanings, and they're still having gums receding. And the cause here is grinding and clenching, often without knowing it. But here's the critical part. These teeth are designed to handle vertical pressure from chewing, not horizontal shearing forces from grinding. And the lateral pressure gets transmitted through the root of the tooth right into the periodontal ligament, which is basically the tissue that connects your tooth to the bone. And this constant trauma is what we call a traumatic occlusion, and it literally shakes the foundation. So the gums respond to this by slightly pulling back from the tooth, and this is a protective mechanism, but it's also permanent. And the body is essentially retreating from an area of chronic trauma. And now here's what makes this so insidious. So most of the grinding happens during sleep, specifically during the rapid eye movement or the REM sleep phase. And that's when your protective reflexes are basically turned off. And here you can basically generate forces during your sleep that you can never produce when you're awake. And that's why people wake up with a sore jaw and they have no memory of clenching. And the pattern here tells a story. So if your recession is primarily based in the canine or in the premolar region of your mouth or on one side, then it's a classic sign of grinding damage. And the solution here isn't just a night guard, even though that's important. So a properly fitted night guard from your dentist helps redistribute the pressure across all your teeth instead of concentrating on just a few. And I wouldn't recommend using a drugstore version of a night guard because they're often too thick and they can worsen your bite, and sometimes they can even increase the clenching because your jaw is trying to find a comfortable position to reposition to. And beyond the guard, you need to address the triggers. So stress management, sleep hygiene, and possibly even Botox injections into the masseter muscle in severe cases. Okay, so moving on to reason number 2, and that is inflammation. But this is where it gets complicated because we're not just talking about red, puffy gums. And the process here starts with something known as biofilm formation. And bacteria in your mouth, they don't just float around randomly. They organize into sophisticated communities, which we call biofilms. And these are like bacterial cities. They have their own communication systems, waste management, and defense mechanisms. And when these biofilms establish themselves along the gum line, your immune system detects them as foreign invaders. And so far, so good. That's what your immune system is supposed to do. It sends inflammatory cells to the area to fight off the infection. But here's where it goes wrong. These biofilms are incredibly hard to disrupt once they mature, and they form a protective matrix, and that makes them up to 1,000 times more resistant to antimicrobials than individual bacteria. And your immune system is sending inflammatory chemicals, but they can't clear the infection. And that's what we call a chronic low-grade inflammation. That's what happens when the gum starts to slowly detach from the tooth to create more space for the immune cells to fight. And they end up forming pockets. And once these pockets are deeper than 3 millimeters, they become self-perpetuating. Now, normal brushing and flossing can't reach these areas when they become more than 3 millimeters. So more bacteria accumulate, causing more inflammation, and they end up then eventually creating even deeper pockets. Now, here's the thing. This inflammation is largely painless in the early stages. And the first sign most people usually notice is bleeding when they brush or floss. But by the time you're seeing blood, the inflammatory process has been going on for weeks or possibly even months. There's also another type of inflammation that's even more dangerous, which is systemic inflammation. And poor oral health doesn't just stay in the mouth. So the bacteria and the inflammatory chemicals, they enter your bloodstream through those bleeding gums. And this is gum disease is linked to heart disease, diabetes, and even Alzheimer's. And basically the same inflammatory pathways that destroy the gum tissue can contribute to arterial plaque, insulin resistance, and brain inflammation. And recent research shows that people with severe gum disease have 2 to 3 times higher risk of heart attack and stroke. And the bacteria from the mouth, particularly the one called Polymorphonis gingivalis, have been found in arterial plaque and brain tissue in Alzheimer's patients. And here's what makes this even more critical. So certain health conditions make gum inflammation worse. For example, diabetes impairs immune response and delays wound healing, or pregnant women. They're at a higher risk because of hormonal changes, which increases inflammation, and even stress, which increases cortisol. And that suppresses your immune system's ability to fight oral bacteria. And the key insight here is you can't just treat the symptoms. So that's why regular professional deep cleanings remove the mature biofilms that home care can't remove. And the third reason is brushing trauma. So this is far more nuanced than brushing too hard. And let me paint a picture of what actually happens when you brush incorrectly. So the gum tissue is delicate. It's about 1 to 2 millimeters thick. And that's thinner than a piece of paper. But when you scrub aggressively against that with a toothbrush, you're essentially sandpapering that delicate tissue. But it's not just about the pressure, it's about the physics of how you brush. So when you use a sewing back and forth motion across your teeth, you're creating what engineers call repetitive stress fatigue. and each stroke might not cause visible damage, but over time, that cumulative effect weakens the tissue structure, and the damage is progressive and irreversible. So, unlike other parts of your body, once gum tissue recedes, it cannot regenerate. And once those attachment fibers are broken, they're gone forever. And here's something critical. So, the type of toothbrush matters more than what most people realize. Now, hard bristles aren't just unnecessary, but they're actively harmful. And even soft bristles can cause damage if they're used incorrectly. And the key here is the angle and motion. So most effective and safest technique to use is called the Bass technique. And basically you need to hold your toothbrush at a 45-degree angle towards the gum line, and in small, gentle circular motions, let the bristles just do the work. And here's a small test you can do. So look at your toothbrush after a month of use. If the bristles are frayed and bent, you're applying too much pressure. And the bristles should remain relatively straight for 2 to 3 months with the proper technique. And electric toothbrushes here can be game changers, only if you use them correctly. So newer models have pressure sensors or red lights built in, and these are particularly valuable because they alert you when you're pushing too hard. And the timing is another crucial factor most people ignore. So if you just had something acidic, coffee, citrus, wine, even diet sodas, your tooth enamel is temporarily softened, and brushing within 30 to 60 minutes of that acid exposure can cause more damage than brushing at any other time. So the acid basically temporarily dissolves the mineral structure of your enamel, making it vulnerable to abrasion. And if you brush during this window, you're literally scrubbing away the softened enamel and irritating the already vulnerable gum tissue. And so the solution here is to wait at least an hour after eating or drinking something acidic before brushing. And you can also rinse with water immediately after an acid exposure because that helps neutralize the pH levels in your mouth faster. And here's where all of this can get really concerning. So all these three causes or factors don't just exist in isolation. They often create a synergistic effect, which accelerates the gum recession far beyond what any single factor would. And thank you for watching. I'll see you in the next